Well, hello. Would you like to start by introducing yourself?
Sure. So I'm Dr. Paul Willis. I'm a senior lecturer in social work at Bristol University.
I'm Michelle Wraithby and I teach on the social work programme at Swansea University.
I'm Christine Dobbs. I'm the research officer on our project, which is...
Our project that we'd like to talk to you about today is called Track Trans Aging and Care, and it's about providing and improving dignified and inclusive care, health and social care for older people who are transgender, who identify as trans. So it's a project which commenced March last year.
Yes.
So it's been running just over 12 months. It's funded by Dunhill Medical Trust to April next year, and it's a project based in the Centre for Innovative Ageing at Swansea University.
Yeah.
And would you like to talk about what we mean by trans, Chris?
Yeah, we have the broad definition of the trans umbrella. So people who identify as trans, we mean by that anyone who doesn't feel fully expressive of themselves based on their birth identity. So if there's any discrepancy between birth identity and the feeling of who a person is, that would be a trans person. It can include people such as definitions of genderqueer, gender variant, cross-dressers, trans men, trans women, and of course non-binary people.
Thank you. And what we're going to do now is just ask each other a question about what we think is most valuable about the project and what we're enjoying most about the project. So Paul first, then Chris, and then myself.
Well, the aspect that I believe is particularly valuable and what I've enjoyed most about being involved is the level of collaboration with people in the trans community or from the trans community in Wales. And the project commenced way back in 2013-14 in discussions with ourselves as researchers from the university with members of the older lesbian, gay, bisexual and transgender network for Wales, which is operating through Age Cymru. And we'd done some research around the care provision, or long-term care provision for older people, lesbian, gay and bisexual. But we were very mindful that we hadn't done any research that focused specifically around gender identity and trans issues. And there were members of the older LGBT network who were keen to see that happen. So with those members from the network, and Jenny Ann Bishop is one of those key players, we started having discussions about developing a proposal for a piece of research that would be a mixed method study focusing specifically on older trans people's health and social care needs. So the collaboration started really early, and members of the trans community were involved and assisted me with pulling the scientific protocol together and the original application, having input into that. And then we thought, well, we need to kind of keep this level of collaboration going right through the project, which is when we developed the idea about doing co-facilitating or co-leading interviews, life history interviews with trans people with other members of the trans community. And the collaborations happen in lots of ways throughout the project, through our advisory group, which is made, half the group is, again, people from the trans community in Wales, through our peer interviewers, who are assisting us in data collection and indeed advising on many aspects of the data collection. And we'll hopefully continue to assist with data analysis. And it will continue right through to the end of the project, when we are doing our workshops with professionals, health and social care professionals, and also in terms of helping us disseminate our findings. So collaboration, I think, is at the heart of this project, and so far it's been a really positive journey.
And Chris, as you're central to actually undertaking those interviews with all their distinctive features, do you want to say what you have valued most about
well, that's what I valued most about the project, actually, is the opportunity to be working with peer interviewers. As a cisgender woman, it's been a huge learning curve for me, and I consider myself a trans ally, but I'm becoming increasingly aware of the fact that I am an ally and I never will be wearing a trans person's shoes, and I think it seems like a general assumption, but to be living this experience, and what I'm finding with the interviews is that we have the peer interviewer from the trans community in very much dialogue with the interviewee, who is obviously from the trans community. And I can see how that this is a native culture of which I'm not part. And I come with other sets of skills, research experience. Often I'm the older person in the room with the interviewee, and the peer interviewer is a younger person. But it's very interesting to align. I think I'm aligning myself correctly in allowing the two experts to discuss the issues, and I do see them as being the experts. Obviously I wear a researcher hat as well, and what I'm finding is after the interviews, the peer interviewer and I will debrief, and we come up with sometimes different stories or different slants on what we've heard, and it's shown me the importance of the trans understanding of a trans narrative, things that I would never even have considered. So I think it's working tremendously well, and I think all three of us, we have quite a tight unit at interview. Everyone feels safe and secure and protected. It's a safe space, it's an open space, and I feel privileged to be part of it. And more I cannot say.
That's good.
Yeah. What about you, Michelle? What's your favourite aspect?
Well, like Paul, my professional background is in social work and social care, and I'm particularly interested. I feel that research is fairly pointless if it's just aimed at other researchers. It has to have some impact, and for us to be part of being agents for change. And so one of the things that I'm excited about will happen towards the end of the project timeline of a series of workshops in North Wales and South Wales, with invitations to key stakeholders from health and social care professionals, advocacy groups, key members who wish to come from trans community representation.
So again, you're bringing two groups together with the trans voice. Yeah.
Indeed. And to work together collaboratively using a particular framework of nominal group technique, but to generate ideas that will in turn feed into guidelines for good practice that can then be disseminated to people who are working within health and social care, who may be people of goodwill, but perhaps not very knowledgeable, or a little afraid, or perhaps a bit wary. Will I give offence? I don't know what the issues may be. I need a greater understanding. So having those guidelines generated, and in tandem with that, I'm really excited about the idea of producing digital stories as well, for which we hope to engage a professional a filmmaker who also identifies as trans, which I think will bring that distinctive voice into the whole process of the filmmaking, and to let the trans people who we've been working with, to let their complex biographies sing out, really.
That's nicely put, yeah.
And so things on paper, but things that actually can leap out off the paper, and there will be, you will be able to see the people and hear their voices. And I think that together we hope that that may have a lasting impact on helping to drive through change. We know we're just one small bit in this. There are lots of other people involved in driving through change, but we can do our little bit in helping influence services for and with older trans people to improve them for the future.
Yeah.
I think that's a really good point, that the heart of this project is about making a positive difference for trans people in Wales, older trans people in Wales, in terms of health and social care provision, with older trans people. Yeah. But as you say, while it's hard to get a sense of what level of impact that will be, I hope to have some impact and change in terms of making health and social care services more trans-friendly and more person-centred in their approach.
Yeah.
And we do have a social media presence if people want to find out more. We have a Twitter feed and someone will help me with the handle for that. And we also have a website.
Yes.
For the track project, TRAC. Google it.
Yes.
Hopefully we can attach the information to this aging
Yes,
advice
yes.
online.
We have a great social media presence, but I've forgotten the actual names.
It'll be underneath the video, I'm sure.
It's underneath the video, yes. Well, I've enjoyed that. Thank you very much.
Thank you.